Hello guys, welcome back to Dr. Nadeem Awan teaching videos. Hope you're all fine, you're all okay, and you're also enjoying practicing ultrasonography. Today my topic of discussion is cervical incompetence. It is very important topic because gynecological section or gynae physician and surgeon depends upon the ultrasound finding. And if you give them a proper and correct finding, it will help them to prevent the abortion. So that's why it is very important topic. So please pay attention to this topic, and we will discuss all images, and we will show you the images, how it will come and how you will pick the point and how you will diagnose on the basis of the ultrasonography. So far, the definition of the cervical incompetence is concerned. It is defined as shortened and widened cervical canal. This is a simple definition. The cervical length will become decreased. The normal cervical length should have been more than 3 centimeters, and the width should be like it also should be decreased. So width and length of the cervical canal, if decreased, that would be considered as cervical incompetence. Cervical incompetence is responsible for 15% of all second and third trimester abortion. So because of the abortion, if there is previous history of abortion, so you must consider cervical incompetence. As far as its types are concerned, there are mainly two types: the primary congenital cervical incompetence. As the name shows, it is congenital, so it means when there is decrease in the collagen fiber in the cervix, that will lead to cervical incompetence. And the second is secondary cervical incompetence due to multiple factors, like if there is multiple gestations or multiple pregnancies, patient has been through multiple pregnancies, so there is likely chance of cervical incompetence in later pregnancy. The second thing, if she has been through any gynecological trauma or obstetric trauma or trauma during the labor in previous pregnancy, so there is another great incidence and great chance for the developing of the cervical competence in consecutive pregnancies. And if there is increased level of prostaglandin, so these are the three main factors which leads to develop the cervical incompetence. So far, radiological finding of cervical incompetence are concerned, these are described only for the gravid uterus, for the pregnant uterus. So when the pregnancy is there, you can confidently look for the cervical incompetence. So what are the radiological findings on the basis of ultrasound? So first you have to look for the cervical length. Cervical length, if it is less than 3 centimeters, so there is a great chance of abortion, and that would be considered as cervical incompetence. As far as width is concerned, it should have been less than 2 centimeters. If it is more than 2 centimeters, so again this would be considered as a cervical incompetence. And the third thing, which usually happens in later pregnancy, that is bulging of the membrane into the cervical canal, which is quite visible, quite obvious, you cannot miss that. So therefore pay attention when you are looking for the uterus and you're looking for the you're measuring the fetal head and other parts. Beside this, you pay attention to the cervical canal and also pay attention to the internal os. So far the internal os criteria is concerned, it has not been yet established for the non-gravid uterus, so we cannot say anything until the patient is pregnant. So during the pregnancy you can confirm the cervical length, the cervical width and internal os. But internal os especially can be seen on the MRI. MRI criteria is that should have been less than 4 millimeter. More than 4 mm, that will be called as cervical incompetence. Some of the clinicians who have expertise in doing all these practice, so they usually look for the internal os as well, and they can pick the point and then can easily find out that this internal os is greater than 4 millimeter. So they suspect that there is a likely chance of cervical incompetence. These were all the findings which I have discussed here, but I have very quality images for the cervical incompetence. If you go through all these images, I'm sure you will be able to pick the cervical incompetence right on time, and patient would be benefited from your report. So on these images I will further narrate and further explain as well. so that it should just give grip in your mind. So let's start watching these images. Before going to talk about the cervical incompetence, it's worth to discuss about the ultrasound anatomy. This image beautifully explains all the anatomy. So let's start from the left side. On the left side, you can appreciate fetal head, and to some extent amniotic fluid is also visible in the view. Just next to the fetal head, you can appreciate, indicated by the orange arrow, that is internal os, which is very important, and this is what you have to keep eye on, internal os, when you are scanning a pregnant lady. So this internal os should have been less than 4 mm if you are looking for the cervical incompetence. So just next to the internal os, there is endocervical canal, which is also very important. It should have been collapsed because normally during the pregnancy there is no role for that, and it should be collapsed. So this is called as endocervical canal. Next to the endocervical canal, there is external os. External os has the similar and equally important, so you should have to look for its opening and its area. It should have been less than 2 mm. So this is the criteria for the external os. Just out of the external os, there is area of the vagina. In case of any abnormality within the vaginal surface, you can also look for that area. So this was all related to anatomy of the lower part of the uterus, in which you have to take great care when you are looking for the cervical incompetence. And mind you that this can only be done when the patient is pregnant, when the uterus is gravid. So you have to focus on all these anatomical areas. So the next comes how we can take and how we can measure the cervical length. So here this image shows there are two basically images. The one is in longitudinal view, and another one has also shown the cursor, that the same is longitudinal view. Bladder is visible there, and on these both views endocervical canal is also visible. From one internal os to external os, you have to drag the cursor and look for the measurement. Here on this image, again you can appreciate internal os, external os is also visible, endocervical canal can also be seen. So far the width is concerned, again you have to tilt the probe and then look for the internal os and the external os. This is what the entire measurement is. So you have to look for the length of the cervical canal. So in this image, it has been shown and how you will be able to take the length of the cervical canal. Mind you, when you are utilizing cursors, be careful and be cautious that you are taking the exact measurement. Sometimes with slightly changes in the cursor or slightly movement with the cursor, you might miss the diagnosis. So therefore it is very important, and you should have to be very careful while you are dealing with the cursor. For the better understanding, this again another image has been shown, that how you will take the cervical length. So again I would mention here, put the cursor on the internal os and drag it towards the external os. Here this yellow arrow, this yellow line shows the entire length of the cervical canal. The length of the cervical canal, as I mentioned, it should have been not less than 4 centimeter. If it is less than 4 centimeter, it means that you can label the case as a cervical incompetence. On this slide, you can see the internal os, which is visible clearly. You can see external os, which is also visible clearly. This image is transvaginal image. Cervical canal is clearly visible. You can appreciate endocervical canal. So it's mean this is the method you can take. You can measure the cervical length. Cervical length is quite easy to measure. So far its width is concerned, you have to drag the cursor in a longitudinal way. So in longitudinal way, you put the cursor from the up until down and take the measurement. So this measurement should have been not less than 2 centimeter, because cervical so far the width is concerned, it should have been more than 2 centimeter. Here on this image, it is clearly mentioned how you will take the length, because length is very important. Because of the shortness of the cervical length, there is likely possibility, because of the pressure of the fetus, this may get enlarged, this may get dilated, and abortion ensues. So therefore always take care of cervical length, which is the far most important in case of cervical incompetence. This is transvaginal scan, and on this transvaginal scan you can appreciate the amniotic fluid, because this was gravid uterus, and on the transvaginal scan you can appreciate that internal os is dilated. It is more than 4 millimeter. So the 4 millimeter is a normal criteria for the internal os, but it seems that it's more than 4. It may likely be 6 or 7. Cursor has been already indicated here. In that case, cervical length was normal, cervical width was normal, external os was clear, there was no dilatation of the external os. So far the endocervical canal is concerned, it is yet not dilated, so it means it's a mild degree. Here you can appreciate that there may be mild degree or moderate degree or severe degree. It's best to measure all that. If you keep eye on all these important anatomical landmarks, you may be able to pick the points whether the case is in a mild status or moderate status or severe status. It is always good to mention all these categories because it helps towards the management. So far this case is concerned, it has clearly shown that this is a mild case of cervical incompetence. Only the one point is present for the cervical incontinence, and that is only internal os dilatation. So internal os is dilated more than 4 millimeter. So if you put that on your report, it will help towards the management. So what your report would be, that a transvaginal scan is performed, cervical length measuring blah blah blah, whatever the measurement, cervical width is measuring this and that, and internal os is seen dilated up to 6 millimeter, suggestive of cervical incompetence, and further management is suggested. The another point in that case is most often the gynecologist prefer to put this on the follow-up scan. For example, after 2 weeks or after 3 weeks, if the dilatation is still persists, so they put the patient on further management. This is very clear-cut example of cervical incompetence. In this cervical incompetency, you can appreciate the fetal head, which is clearly visible. Beside this, there is amniotic fluid is visible, and if you look for the amniotic fluid has been gravitated through the internal os until the external os. So here the internal os diameter, internal os width is much more greater than 4 millimeter. It's even reaching up to 1 centimeter. So it's mean this is severe case of cervical incompetence, because all the amniotic fluid has been gravitated downward towards the endocervical canal. Endocervical canal is quite dilated, quite visible. So if you are ignoring that during the scan, so this is this would not be a good practice. So appreciate fetal head, and just underneath the fetal head, beneath the fetal head, the internal os is markedly dilated. Endocervical canal is markedly dilated with filling of the amniotic fluid. So what you need to do is obviously, so for the width of the cervical length is concerned, it would be definitely increase in size. It would be more than 2 centimeter. So far the cervical length is concerned, it seems that this cervical length is also decreased than the normal. So you have to put the report and mention all these three, that the gravid uterus shows dilated internal os up to whatever you have measured, and endocervical canal is also dilated and filled with amniotic fluid. External os was closed in that case. You mentioned that the cervical length was measuring less than 4 centimeter, and cervical width was also dilated. So this is a moderate to severe case of cervical incompetence. Gynae referral is suggested. Further immediate workup is suggested to avoid the abortion. This is another transvaginal scan, and on this transvaginal scan, another spectrum of cervical incompetence has been shown. You look for that white arrow is indicating internal os. Internal os is dilated, and beside this the upper part of the endocervical canal is also dilated. Some of the membrane, like on the upper part, there is no fetal areas, fetal parts can be seen, because of the fact, like you can see, this small membrane is which is going down towards the internal os. It's mean that this is the stage when the internal membrane start bulging into the internal os. In this slide, the given image of the cervical canal and cervical length seems to be clear, seems to be okay, because cervical length is quite sufficient, cervical width is also okay, but only the one point which is visible here, that is dilated internal os. This internal os is more than 4 millimeter, and on the top of it you can appreciate that small part of membrane is trying to bulge towards that. It's mean it has started gravitating towards the internal os. It depends upon the patient's resting position and the patient's physical work. If she keeps on doing physical activity, this is likely that very quickly and swiftly this membrane will start bulging towards the endocervical canal. And if this point has been picked and been sent to the gynae department, they would immediately give attention to the case and advise further rest or whatever their management is. So after that, there is likely that they can prevent the abortion. But if it is being ignored, so definitely the way it is, this membrane is bulging towards the internal os and endocervical canal, it is likely that all the contents of the conception may expels out and the abortion ensues. On this ultrasound image, you can appreciate cervical length. Cervical length is reduced than the 4 centimeters. So this is a case of cervical incompetence. Beside this, if you have a look towards the left on the superior part, so you can see that the internal os is also dilated and it shows small fluid, like amniotic fluid is started gravitating towards that side. However, still endocervical canal is collapsed, it's not yet that much dilated, but as the cervical length is reduced, cervical width is also reduced, so there is likely chance of abortion. So these are 4 points you can appreciate on 3 points you can appreciate on this slide. The one is cervical length. Cervical length is reduced than the normal, it is reduced than 4 centimeter. So for cervical width, which is not shown here, but generally you can subjectively assess that the cervical width is also reduced, because cervical length is reduced, so cervical width would also be reduced. Beside this, you can appreciate that internal os is quite dilated. I think, if I'm not wrong, it would be more than 1 centimeter. So this is likely possibility of abortion. So these are the points. Most often we pay attention to the fetus, we start looking for the fetal parts and all the other areas, and we ignore this important area. This is very important, this is very quite important area in respect of abortion. If patient gives you the history of abortion, so you must pay attention to that part. Or the patient is primigravida. In primigravida, you never know what is the status of her uterus, what is the status of her cervical canal, whether there is some cervical incompetency or not. So therefore, in primigravida patients and the patient who have already history of abortion in the past, so pay attention to that and always document. It is always a good practice when you are scanning obstetrics and you are looking for the fetal well-being, always document about the cervix, cervical canal, cervical length and the internal os. This is another important slide, and what I would say here, if I would have examiner, I would definitely put this slide in front of my students and I would tell them, please explain that. But anyhow, today I'm student here for you, so this I'm going to explain it for you. Look at the fetal parts are visible on the left side. Amniotic fluid is clearly visible. These arrow are indicating, the first arrow is indicating internal os. This internal os is dilated, so this dilatation can be shown. Beside this, small streaks of fluid, amniotic fluid, has been gravitated towards the endocervical canal, which is again shown by the another arrow. One another point you can immediately pick, that cervical length is markedly reduced. So I think this is even less than 2 centimeter. So this cervical length is quite small, quite narrow, and beside this, if you look for the width is also markedly reduced, small in size. So this is a particular case of cervical incompetence. This has been picked on the serial imaging, and when they focus on the cervical part, they appreciate that the cervical length is markedly reduced, the cervical width is also markedly reduced. Beside this, they appreciate that small amount of amniotic fluid being gravitated towards the endocervical canal. So they put all these information on this on the report, and ultimately gynecology picked the points, and they started the patient's proper management, and they saved the pregnancy. This is another classical example of cervical incompetence. Here towards the left, you can appreciate the fetal head, which is clearly visible. Just adjacent to fetal head, there are 3 important findings, radiological findings you can pick. Number 1 is internal os is markedly dilated, and number 2 is fluid is gravitated towards the endocervical canal, and the third thing, which I'm sure you can, which pretty much clear here, that is bulging of the membrane into the endocervical canal, and the cursor which is been shown down here, mean they shows, these cursor shows that small up to 1 centimeter area has been left for the membrane to expels through the external os. So this is quite dangerous condition, it needs immediate attention. The another important point you can pick on this slide as well is cervical length. So cervical length is very shortened, so this cervical length, I think it is up to 2 centimeter. Normal criteria is 4 centimeter, it should have been more than 4 centimeter, but here in that case it is less than 2 centimeter or up to 2 centimeter. That's why this is the reason that internal os was quite dilated, and because of that marked dilatation, the membrane has been gravitated downward into the cervical canal, and only less than 2 centimeter area has been left to allow the internal membranes to comes out. So this is a quite serious case. So you have to put all these informations on your ultrasound report, and with that mark, that immediate attention is required to prevent the pregnancy due to the severe condition of cervical incompetence. This is a quite extensive case of cervical incompetence. On this image you can appreciate the fetal parts, and beside the fetal parts you cannot easily distinguish the dilatation of the internal os, because there is no longer maintenance of the internal os, there is no integrity of internal os. Internal os is markedly dilated. Beside this, amniotic fluid has been expelled into the endocervical canal. These 2 points can be picked quite easily. The third point which needs attention is expulsion of the I would rather say expulsion of, because the membrane is gravitated down into the endocervical canal up to an extent where it directly reaches to the external os, and it is about to expels. So therefore you can appreciate this membrane is gone down up to an extent where it is about to expel from the external os. So that's why it is a severe case of cervical incompetence. So this patient needs immediate attention, because of the fact that it is likely that at any point this fetus will comes out and the abortion ensues. Mention on the report that the cervical canal length, measure the cervical length, and beside this mention that there is no integrity of the internal os has been maintained, it's markedly dilated, and a part of the membrane has been expelled into the, or rather filling the endocervical canal, and it is directly touching to the external os. Beside, amniotic fluid is also filling the endocervical canal. This is cervical incompetence, severe cervical incompetence, and immediate attention is required to save or to prevent the pregnancy. On this ultrasound image, the findings has been showed that these are the ultimate outcomes of the cervical incompetence. On this image, you can appreciate that the cervical canal is completely filled with the fluid, and one of the limb of the fetus has been came out of the internal os, and it is into the endocervical canal. Fluid has been already came out, so this is like I would say, abortion is evident. So you cannot control this abortion any longer, because one of the limb has been already out, so some other part will definitely be out in a period of time. So it needs immediate attention. If it is brought to you for the scanning purpose, just mention this important sign. Look for the patient's viability. Mention that the external os is enlarged enough that allowing all the part of or the limbs of the fetus into the endocervical canal. And obviously on this image, external os has not been shown, but anyway, this was our concern for the cervical incompetence. So this is clear picture of cervical incompetence, rather I would say outcome of cervical incompetence ultimately, because this will ensue abortion, and the ultimate outcome of the cervical incompetence is abortion. So here this image shows clearly that some of the part of fetus has been expelled out from the internal os, and it is down into the endocervical canal, and this is an aggressive case of cervical incompetence, and abortion is likely to ensue. Yes, friend, this was all about cervical incompetence. I'm sure you must have got all the information regarding cervical incompetence, and you will be confident to pick all these points regarding the cervical length, cervical width, as it should have been more than 4 centimeter normally, and if it is less than 4 centimeter cervical length, it would be considered as cervical incompetence. As for width is concerned, it should have been more than 2 centimeter. If it is less than 2 centimeter, again it would be considered as cervical incompetence. And if you could see any membrane bulging into the cervical canal, that is the obvious diagnosis for the cervical incompetence. As far as internal os is concerned, many clinicians who used to do the practice and give attention to pay attention to the cervical canal, they usually pick the internal os dilatation as well. So this was all about the cervical incompetence. If you have any query, just drop me a message and I will get back to you. Try to share this video to other colleagues, especially gynae colleagues, so that they should have an idea what the radiological measurement are for the cervical incompetence. And yes, keep sharing with other graduates and other colleagues as well. We'll see each other with some new information and new videos. Till then, take great care of yourself. Bye bye.